How are we going to get our patient back up and moving and grooving? We need to add some serotonin back to this brain. So the goal is to boost that serotonin level so that the patient can actually gain that balance, right? But it's going to take work, and it's going to take long-term work. That serotonin, when you start that patient on the SSRI, it's going to repair the damage from the HPA axis. But it's not going to happen instantly. The key thing that you need to know as a provider is that it's very slow to be therapeutic. What are you going to do in that time frame, right? Especially if you have an urgent acute case of anxiety disorder. What if they're having panic attacks, right? What if they have panic disorder, right? You may need to prescribe them with some benzos, or not for long term. They're not for long term, but they really work quick. And that will be effective on helping your patient regulate the mood, increase that GABA. So putting them on that benzoid works a lot better in that acute phase while things over here are being repaired with the SSRIs. So that is anxiety in a nutshell. Of course, on a therapy level, we do recommend that patients with generalized anxiety disorder work with medication and a therapist, have some type of therapy plan in place, as well as a medication treatment plan. Generalized anxiety disorder is the #1 mental health disorder amongst our population. We're going to deal with on a regular basis when we're seeing our patients, and we're going to have to know what's the next best step. I'm going to come through with some more videos, more specifically with treatment and what to do when things are not working, how to go about first line drugs, and so forth. So I hope this was helpful, though, to at least help you understand the brain components and what's happening when anxiety presents itself.